All right, a subdural hematoma. Subdural hematoma is a serious medical condition where the blood collects between the surface of the brain and the dura mater, or the dura mater, which is the outermost of the three membranes or meninges that cover and protect the brain. This collection of blood puts pressure on the brain, and if left untreated, it can lead to severe brain damage or death. We have a figure here shows epidural hematoma versus subdural hematoma. Epidural hematoma is rapidly expanding with arterial blood, skull fracture, middle meningeal artery, scalp and skull. Then we have the subdural hematoma is slowly expanding with venous blood, dura attached to the skull, the cerebral cortex, and subarachnoid space. Causes and symptoms. The most common cause of subdural hematoma is head injury, especially one that involves a sudden, violent blow to the head. This trauma can tear the small veins that run between the dura and the brain, causing blood to leak. It can be caused by falls, especially in the elderly, car accidents, or assaults. Symptoms can appear immediately after the injury or develop slowly over days or weeks. Common symptoms include headache, confusion or difficulty speaking, nausea and vomiting, dizziness, weakness or numbness on one side of the body, and loss of loss of consciousness or coma. Types. Subdural hematomas are classified based on the speed at which they develop. Acute subdural hematoma. This type develops immediately after a severe head injury and is considered a life-threatening emergency. Subacute subdural hematoma. Symptoms develop over a few days to a few weeks after the initial injury. Chronic subdural hematoma. This type develops slowly, and symptoms may not appear for weeks or even months after a minor head injury. This is more common in the elderly as the brain shrinks with age, leaving more space for blood to accumulate. Oh no, the brain shrinks with age. We gotta keep it big and learning. All right, gotta keep it activated and stimulated. Treatment. Treatment depends on the size and location of the hematoma and the severity of the symptoms. In some cases, a very small hematoma may not require treatment. However, larger or symptomatic hematomas require medical intervention, which often includes surgery to remove the blood and relieve the pressure on the brain. Subdural hematoma. All right.